Hello and welcome to the Nurse Rosa's Insights podcast. We're coming to you live from ViVE in Los Angeles, California. This is a health tech conference where all these different thought leaders in healthcare are coming together to talk about how we can use technology to build new solutions to make healthcare better. And today I get to talk to Brian Robertson. Thank you so much for being here with me today.
Well, thanks for having me.
And so when you're here at ViVE, what's your favorite thing about the conference?
The energy. I think health and ViVE has kind of taken over in like having the most energetic concert or the most energetic conferences, DJs at the booth and games, and I just like the overall vibe and energy that's here. People are like passionate.
Right? And
yes.
A lot of people, when they talk about healthcare, they don't have a very positive vibe at all, do they? But
yeah, that's true.
ViVE,
that can be the case.
We do. We're interested in the future.
That's right.
So can you tell us a little bit about your work and what you're doing to make the future of healthcare better?
Yes, sure. So at VisiQuate, we take data, like lots of data, accounts and transactions, charges, claim files, remittance files, sometimes the CCD and the CCDA. We take the continuity document. The continuity CCD is the... What's it called? I got to remember now.
No, I use so many letters.
Continuity of care document.
It's
got like vitals and stuff in it.
Okay.
And sometimes that's used to facilitate and support like pop health use cases or performance-based reimbursement. Part of it though is like we take as much data as we can and sort of like end to end. We're on the business side of healthcare. Mm-hmm. While you great nurses are like in docs are treating the patient, we're taking all the data to make sure that the hospital gets paid, the provider gets paid, so that those dollars go back into patient care. Like that's what we're really passionate about. Like we're tech people and software people, but the reason we exist is to get rid of the administrative waste, make sure hospitals get paid, make sure that dollars get directed to care, and then make a dent in the financing for the patient, giving the patient options, better financing plans.
Really?
Yeah.
Wow, that's interesting, especially because we're going to have a lot more self-paying patients as well. So do you work directly with individuals, or how does that work?
No, we supply the analytics, the scores, the intelligence that the providers use in patient access or the business office to offer the best, basically like the best plan for the patient, kind of meet them where they are with their finances. So advanced scoring and augmented intelligence can make a difference in the value that the patient or the guarantor perceives.
And before we started, I think we were talking about something with appeals. Just some of the data that you're like collecting together help play into an appeals process to ensure that if people are getting this care, that it's being reimbursed appropriately.
Yeah, 100%. So a big part of what we do is help providers with denials of all shapes and sizes. So claim denials, administrative denials, like missing information, things like that. But then on the clinical side, all the data and the scoring and the intelligence, the recommendations are about getting that appeal overturned and helping providers, like when payers do what we call hidden denials, they downgrade claims and the dictation's there to substantiate it. We help them make sure that they can substantiate the claim and get paid, really. Yeah. So we're trying to help level the playing field for the provider in this sort of occasional war that happens between the provider and payer, and making sure the patient doesn't get stuck in the middle. So it's all about providing that intelligence that makes the hospital earn the revenue that we think they have earned.
With that documentation.
And there can be process leakage, so some of the intelligence is making sure that the provider fixes their process as well. Other times it's the payers playing games at times, so we want to level that.
Sometimes health insurance companies use AI to automatically deny claims that are totally valid. So are you guys like the counter to that, using the AI to combat it?
Yeah, I want to be mostly an optimist and positive about this because I think the providers and payers are getting along better than they have in a long time, and they're trying to collaborate. They're both trying to take administrative waste out. And at the same time, there are times where they disagree on a batch of claims or a single claim. So we're trying to help almost like be an arbitrator in that process, provide the intelligence that can collaborate. And there are times where the payer's going to win, and there's times that the provider's going to win. There's times that the provider's going to better defend themselves because they have the data.
Right. If you don't have the evidence to share, then you just have to go with the data that you have.
And the data can live in so many places. It can be very fragmented. So our job is to kind of pull it all together.
And how do you aggregate that?
So like one of our specialties is data curation. We have a long career of taking data and orchestrate it, normalize it, cleanse it, and then join it and augment it. So it's all about making sure that the right data in the right hands at the right time to take action. It's just one of those things. There's like a science to data curation, and some of it is high tech and involves algorithms and a bunch of fancy technical terms. Some of it's like a bit of a grind, and you just have to have a good attitude about data organization. It's not for everybody, but it's sort of table stakes if you want data to be positioned even for AI. You can't take action on data unless it's in some really actionable state, and many times it's just not.
So we were talking before about how there's a lot of concern about hospitals shutting down due to lack of reimbursement that they are accustomed to, with some big changes in reimbursement. Do you have any stories you could share about when hospitals or offices have been able to have enough savings to keep the doors open and maybe even grow?
Yeah. The role that we try to play in that is, often the receivables, we're involved a lot with, again, making sure hospitals get paid from all payers, not just patient pay. Receivables can be like the largest asset on the balance sheet. It's either the largest or the second largest next to property, plant, and equipment. So if you have a 1% problem in your receivables or denials or bad debt expense, it's a significant impact on the hospital. So we're either trying to make sure that they get paid or we're fighting the administrative waste. Because, you get millions of dollars, at stake on the yield side of things, just making sure you get paid, and millions of dollars connected to administrative waste. So if any of those things, go the wrong direction, you can't make a down payment on the cardiac wing. You can't invest in modern tech, new medical devices, new infusion pumps. So we really see our role, again, we're on the business side of healthcare, but we see our role to make sure that hospitals get paid so they can invest, right? They can have more margin, because to your point, they're getting hammered these days. And you got to fight for every dollar.
Right. And some of the best return on investment you can have with your dollars in healthcare are in your nursing staff.
Yeah.
So if you're saving them $1 million from administrative waste, then they could perhaps have some more regular nursing staffing on their units so that their fancy pumps have people to run them. Or
That's right. Humans in the loop are still needed.
Definitely. I remember during COVID, I live in Kentucky. Our governor is Andy Beshear, and he used to come on the TV every evening at 5 p.m. And he would talk to us about the importance of how many beds were available in the state of Kentucky. And I was very thankful that he emphasized those beds might physically be there, but there's not a nurse to staff all of these beds. And that's why the numbers of available beds would fluctuate, because it would fluctuate based on the availability of nurses, not on the physical beds. So I really am glad that we are able to have these conversations about prioritizing the staffing of nurses in a safe way, because all the technology in the world doesn't do us any good. There's no healthcare without nurses. Here at ViVE, we have a lot of nurses who are interested in getting involved in technology solutions to be part of the solution. Are there any ways that they can get involved in helping come up with some efficiency use cases?
Yeah. By the way, nursing is near and dear to my heart. My mom was a nurse. I have a daughter who's a nurse. And so I thoroughly appreciate all the work that nurses do, not just at the bedside, but I think it's about making sure that all the data is available for all workers in a hospital to make good decisions. Again, my view is right decision at the right time is really critical, whether it's a biller, collector, case manager, or it's a nurse or a certified nurse assistant. The more that they have current time intelligence, the better that they can make decisions. I like the idea of just optimization inside the walls of the hospital, the logistics and optimization of patient flow and patient experiences. The better you are at data and using data properly for advanced decision making. And again, that real-time decision or current time. I sound biased because I'm a data guy, but data is the key to augmenting everybody, whether it's a conventional process or it's as we're heading into AI, an AI-related process. It has to be rooted in a good process at the start. So we really see like data and machine learning and things like that as catalysts or augmenters, because it's all about making decisions, right? Every day in a hospital, you got to make a lot of decisions. And the nurse, how many decisions per day does a nurse make?
A lot.
Right.
And they compound exponentially with interruptions.
Yeah,
because
sure.
It's like you make your plan of what you're going to do during the day, and then somebody needs ice water stat. And you have to prioritize that versus
That's
like
right.
this alarm that means somebody's not breathing over there. And then how do you communicate that without ruining your
Sure.
patient experience scores
Yeah.
because my nurse didn't bring my ice water
juggling.
fast enough. Yeah, it's a lot
Yeah.
of juggling. So having that data would be very helpful, and I'm really thankful to have it brought in so we don't waste our time on inefficiencies.
And I think nurses, this is happening, we see it, but like collaboration between nursing and case management and the business office and patient access, it's, I like when we see with our clients that kind of collaboration happening, because it kind of takes a village.
Yeah.
It takes a lot of, looking at end to end what happens to a patient, every attribute, metric, every process, every micro process. So the more that they're around a round table talking and then saying, how can we use data or AI to build a better mousetrap? And how do we augment nurses? Because if there's a nursing shortage, we ought to look at the gap that smart AI, pragmatic AI can serve in addressing that shortage. Yeah.
Well, the signature question that I ask everyone on the Nurse Rosa's Insights podcast is, if you were given a grant for $1 billion.
$1 billion? Ooh.
Just one.
Just one.
To meet a need that you see in healthcare. It could be something you're already dealing with, or it could be something you've seen in your years. Didn't you say you've been working with this company for 17 years? Is that what you said?
Yeah, VisiQuate has been around for 17 years.
Yeah, so that's had a good amount of time to focus on this issue. So there might be another issue that you really care about, and you're like, well, if somebody else will just go over there and fix that, then the downstream effects would make a sustainable difference, right? So if you were given a grant for $1 billion to meet a need you see in healthcare, how would you like to see it used strategically to have the most sustainable impact?
Yeah. It's connect the dots on some of the things we talked about. It would be setting up a smart data and AI process to go after administrative waste. Because if there's, just in the revenue cycle alone, there's 300 billion plus of administrative waste. And just think about that. That's so $1 billion to go after 300 billion. Easily, every guidance, every report, you could cut that waste in half. And you can do it today, I believe, a lot faster because of the power of AI. And the pragmatic, intelligent application of AI. Not the buzzwords, but like AI wrapped around good process, AI wrapped around good human brains, smart humans in the loop. The right combination, it takes all the collaboration, coming up with models that are systems of action, systems of intelligence, that are directed at administrative waste and tackling administrative waste and making sure that we don't flush dollars down the toilet, right? Because all that money should be directed towards care. It should be doctors, nurses, making the hospital thrive, making the community thrive, and then actual value to the patient should be tangible in their hands.
I love that. That paints a beautiful picture. Let's build that future.
It's the way it should be, right?
It should be. Let's make it happen.
Let's make it happen.
You like that?
I'm in.
All right, good deal. And then if people have liked what you have to say and would like to reach out and discuss more, should they find you on LinkedIn?
Sure. Yeah, I'm on LinkedIn as Brian Robertson. There's a few of us, kind of like John Smith. So Brian Robertson and VisiQuate.
And I'll have those links in the show notes. Then if you've enjoyed this episode of the Nurse Rosa's Insights podcast and you'd like to see more of what we have going on here live at ViVE, make sure you like and subscribe wherever you're listening or if you're watching on YouTube. And I'll see you in the next episode.